Hey everyone, I'm Dr. Krystal Lynn Couture. I'm a physical therapist and acupuncturist at Pure Balance Holistic Healing in Portsmouth, New Hampshire. You're here because you are concerned about your pelvic health and you're probably looking for some pelvic support and pelvic care. I think that education and knowledge are empowerment. So what I want to do today is share with you a little bit about the anatomy of the pelvis. So first up, that's how our pelvis sits. This is my demo pelvis, and I want to share with you a little bit about what is happening here. So we have the bone structure that we want to consider first. Okay, so these bones are those bones that sit right at the top of our hips here. Those are the iliac crests. Okay, so we have the iliac crests. These become the pubic bone. The pubic bone is that bone that we find if we follow our abdomen down, 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 and we sit our little thumbs right on that pubic bone. Okay, these guys right here, these are the ischial tuberosities or the sit bones. So if you're sitting in your chair and you kind of rock back and forth side to side, what you can feel when you're sitting, those are those sit bones. Those are the ischial tuberosities. These make up what's called the innominate, okay? So that's the pelvic girdle. Now, if we look at the back, we can imagine that the spine would come up here. So this is at the base of the spine. This is where the last lumbar vertebrae or the last low back vertebrae sits. And then this bone right here is the sacrum. Okay, so the sacrum is this triangular shaped bone that closes in and connects the two bones of the pelvis. All right. At the very bottom of the sacrum, we have the tailbone or the coccyx. So that's really the bony structure of the pelvis. Now, there are a lot of things that can go on within this bony structure. What I want you to remember is that these guys right here, where the sacrum and the ilium come together, those are called the sacroiliac joints. They are joints, they are mobile. You might have heard of sacroiliac joint pain before. That's pretty common when it comes to pelvic pathology. We also have another joint that's important to consider, and it's this guy right here in the front. So this is the pubic symphysis, okay? The pubic symphysis is where the two bones of the pelvis come together and join in the front, as we mentioned. So where we palpate down our abdomen, that's where we can feel that connection. This is also a joint. So there are those three articulating joints of the pelvis. Of course, we can see here, we've got nice socket, and that's a socket for the ball of the hip to go into on the right and on the left. Okay, so we have those hip joints as well. So there's a lot of joint movement within the pelvis that's really important. We also have a little joint here where the sacrum and the coccyx come together. Now, in most cases, there's not a lot of play here, but there can be a little bit of play. So it's important to note. While we're at it, let's talk a little bit about what we have going on with the muscular anatomy. Okay, so this guy right here, this nice big muscle, that's actually the piriformis muscle. It may be a muscle that you have heard of if you're looking into what might be what might be going on with your pelvis. Okay, this guy is the coccygeus muscle. See that coccyx bone again that we talked about? The coccygeus muscle comes right off of that. So that's another muscle that we have to consider when we have especially sacral pain, pelvic pain, or coccygeal pain, right? This little tail, that's the obturator internus. The obturator internus, like the piriformis, is a deep rotator of the hip. There's actually 6 of the deep rotators of the hip. So those are on the back side, and they're really important to what is happening deep within the pelvis. Now, if we look inside the pelvis here, we can see kind of a bowl-like structure. Okay, that bowl is essentially a hammock of muscles. Now, what this bowl, this pelvic floor, this pelvic bowl, whatever you'd like to call it, does is it supports the internal organs. Okay, so you can see right here, and these are not in center because they're just like a wiggly type of silicone, but this is going to be the opening for the anus. So we have the colon that's supported by the pelvic floor. Then we have, this is a female pelvis, so we have the opening to the vagina. Okay, so the vagina or the womb will be supported by the pelvic floor, And then we've got this guy right here. That's going to be the opening to the urethra. So we have the bladder as well. So we're supporting the organs of urinary, of fecal, and of reproduction, right? And they sit nicely in this pelvic bowl, okay? Now, the pelvic musculature, what it does is it supports those organs, right? It keeps them in the space that they're meant to be in. It also helps with the opening and the closing of those holes, right? Which makes a big difference for incontinence. It also impacts constipation, diarrhea, etc. And of course, there's going to be sexual function that the pelvic floor impacts. So it's going to impact our bladder function, our bowel function, and our sexual function, as well as our structure and our posture. So let's talk about specifically those pelvic floor muscles, okay? So we're going to start on the backside, actually. So this is the anus, and this is going to be the external anal sphincter right here, okay? So we've got that there. And then these muscles here, this sort of layer of 3 muscles that are kind of grouped together, that's what's known as the levator ani. You may or may not have heard of that before. Levator ani is comprised of the puborectalis muscle, the pubococcygeus muscle, and the iliococcygeus muscle. Okay, so those are the 3 muscles of the levator ani, which are the big muscles of the pelvic floor. Now, I'm going to flip my pelvis over. We're going to look at the front now. Okay, so there's that, the anus and the external anal sphincter. This is going to be the perineal body, the space between the anus and the opening to the vagina, right? There we go. Okay, so now coming right off of that perineal body, this muscle here is called the transverse perineal muscle. Okay, so it's another muscle of the pelvic floor. It's one of the more superficial muscles. Another superficial muscle right here, okay, we've got the ischiocavernosus muscle, and that follows the bottom rim from the ischial tuberosity, right, to the inferior aspect of the pubic bone. Okay, so ischiocavernosus. And then we have our bulbospongiosus muscle, okay, which is going to come around here. Okay, so the bulbospongiosus muscle is going to have a direct impact on sexual function, sexual pleasure, as well as the opening and closing of the vaginal opening, right? Okay, so that's your basic anatomy lesson of the pelvic floor. I hope this is helpful, and I do hope that it's important and resonates with you in taking your pelvic health into your own hands. It's always important to have a professional that you can collaborate with and work with that can support you, but having a basic understanding of what's happening is super duper helpful in being able to use language to communicate with your practitioner, to communicate with your PCP or your gynecologist, what's happening in there. And to know a little bit about the pelvis can really help you to find language and also be empowered to talk about pelvic health. I want to end today just by saying that 32% of women and 16% of men are experiencing pelvic pain or dysfunction. And in my opinion, as someone who specializes in pelvic health, that number is way too high. And some of that pain and dysfunction can be alleviated by having some knowledge of making lifestyle changes and also working with a practitioner that can support you. So thanks so much for joining me, and I hope you learned something today.